Do I wish cataract surgery had a 100% satisfaction rate? Absolutely. Is that the reality? Unfortunately, no. Sometimes us eye surgeons have patients who are unsatisfied with their cataract surgery and may regret their decision to get it done. So in this video, I'm going to go through the top 5 reasons why patients regret cataract surgery and what you and your ophthalmologist can do to prevent you from having these regrets. By the way, I'm Dr. Michael Chua. I'm a board-certified ophthalmologist, and I make videos to help you see better, look better, and feel better too. Okay, the first reason why patients may regret their cataract surgery is because their quality of vision didn't meet their expectations. Now, there's a few different reasons why a patient's vision didn't meet their expectations, and I'm first going to break down the reasons by lens type. Let's first talk about multifocal or extended depth of range lenses. The benefit of these lenses is that they provide a range of focus after cataract surgery. The basic monofocal lens that's covered by insurance has one focus distance. So for example, if you have your vision set to distance vision after cataract surgery for anything closer up, say the dashboard in your car, your computer, cooking, looking at your cell phone, or reading, you'll need reading glasses to see more clearly. The benefit of multifocal or trifocal lenses like the Odyssey or PanOptix lenses is that they provide a range of focus, helping you see distance, intermediate, and near objects. How these lenses basically work is that they split the amount of light going into your eye into different focus points to give you a greater range of vision. But because that light is getting split into different focus points, there are some trade-offs to get that range of vision. For example, you may notice some decreased contrast, or basically, patients mention that, especially in darker settings, things are just a little bit fuzzier and it's harder to notice the details in your visual world. The other thing to be aware of with these lenses is that because of the design of the lenses, you can see that there's a bunch of concentric rings in the lens, as opposed to a monofocal lens which doesn't have the rings. With these multifocal or trifocal lenses, when you look at lights, particularly at night, you'll notice rings or starbursts around the lights. And one last point about these lenses is that there may still be sometimes, not too often, but sometimes, particularly when it's a little dark or you're trying to look at something very close or very small, where you might need a pair of reading glasses to magnify your vision a bit. And so if patients aren't aware of these trade-offs before surgery, or maybe they're promised perfect vision at all distances without ever having to wear reading glasses, sometimes patient expectations for their vision after surgery aren't met. And so realistically, these lenses are excellent, but not perfect. The vast majority of patients with these lenses report that they're very satisfied. But the truth is that they have trade-offs, such as decreased contrast sensitivity and those nighttime rings and starbursts. And even though our lens technology is very good, there is no artificial lens implant that exists that will allow us to turn back the clock and give us that crisp, perfect vision at all distances like we may have had when we were all younger. Okay, now let's talk about monofocal lenses. There are also patients who decide to go with a basic monofocal lens and are dissatisfied with their vision after surgery as well. Like we mentioned before, these monofocal lenses have mono or one focus point. So if we set your vision to distance vision, then distance objects will be more clear, but anything closer than say 2 or 3 feet or about 1 meter away, anything closer than that will be out of focus and blurry. And so patients, particularly if they've had myopia or nearsightedness their entire life, patients with myopia are used to having clear near vision their entire life and using glasses to see clearly for distance. But if they get monofocal lenses set to distance, then they're going to lose all of that near vision after surgery. And these patients can be disappointed with their vision after surgery, even if they're technically reading 20/20 on the distance vision test, because now they need to reach for reading glasses anytime they want to look at their phone, or their dashboard is blurry when they drive, or it's a little blurry when they're trying to cook. So for this reason, it's very important to discuss with your surgeon prior to surgery exactly what the plan will be for your focus point after surgery, and when you'll need to wear glasses. Another useful tip is to take a few minutes to think about what you use your vision for on a daily basis. Everyone has a different routine. Are you driving a lot? For driving, you're going to want clear distance vision so you can see oncoming traffic and street signs. Or do you like to spend more time reading and watching videos? And if so, what kind of monitor are you using to read or watch videos? Is it the TV across the room, which uses distance vision? Or maybe it's a computer screen 2 to 3 feet away, which would be considered intermediate vision? Or is it on a phone that you're holding about a foot away from your face? In that case, we'd consider it near vision. Do you sew, knit, cook, hike outdoors, garden, play sports? And when you think about these different activities that you're doing throughout the day, you have to prioritize. Okay, what type of vision is most important to you. Is it near, intermediate, or distance? Again, with monofocal lenses, we're forced to pick a singular focus point. So we want to decide together what type of vision is most important for you and when you'd be willing to wear glasses. So if you're starting to think about your preference prior to your surgical consultation, it gives you more time to think about it and come up with a decision that will satisfy you the most. The other regret patients sometimes share with me after choosing a monofocal lens is that they wish they had chosen a toric lens instead. So what's a toric lens? Well, toric lenses are special lenses we can implant during cataract surgery to address a patient's astigmatism. Okay, so what's astigmatism? Astigmatism occurs when the front of a patient's eye, their cornea, is not shaped regularly. Normally, the shape of our cornea is more round, like a ball, but in some patients, their corneas are shaped more oval, kind of like eggs. When the surface of the cornea is not nicely symmetrically shaped, then this astigmatism causes incoming light to not be focused properly, causing blurry vision. So, people with astigmatism need to wear glasses with an astigmatism prescription in them to help them clear up their vision. So, if a patient has astigmatism and decides to get the basic monofocal lens with cataract surgery, they're still going to have that astigmatism even after cataract surgery. So their vision at all distances, meaning near, intermediate, and distance, everything will still be blurry without glasses. We have special lenses called toric lenses that we can implant at the time of cataract surgery, which have that astigmatism prescription already dialed into the intraocular lens. So for patients with astigmatism, they'll be able to see more clearly after surgery without glasses. And so I've had several patients with astigmatism who come in to see me, and for whatever reason, maybe they weren't offered the toric lens, or maybe they didn't see the value of the toric lens. They did not have that toric lens placed in their first eye. And then they end up getting the toric lens for their second eye. And a common reply I hear from them after surgery is, man, I wish I got the toric lens for my first eye too, because there's a significant improvement in the clarity of their vision without glasses in that second eye that got the toric lens. Now, not everyone has astigmatism, so not everyone needs a toric lens. But if your ophthalmologist mentions that you do have significant astigmatism and that your vision may benefit from the placement of a toric lens, at least consider the option. Of course, if you're okay with wearing glasses all the time, that's a totally fine option too. But in my experience, patients are generally very satisfied with their decision to get a toric lens if they have astigmatism. Okay, so we talked a lot about the importance of lens choice and understanding what kind of vision to expect with the different lenses, whether you choose a monofocal, a toric, or a multifocal lens. Now let's talk about another important consideration for cataract surgery that can cause some patients to have dissatisfaction after surgery, and that's focus point. So we talked about how choosing the correct focus point of your lens during cataract surgery is an important decision for your happiness and satisfaction after surgery. With the basic monofocal and toric monofocal lenses, we have to decide what the focus point of your vision will be. For example, if you want distance objects in focus and are okay with reading and computer glasses, we'd aim to basically leave you with very little to no refractive error or no glasses prescription. If you spend a lot of time reading or on your phone, maybe you don't drive too much, and you tell me you want your near vision to be in focus instead, then maybe I'll leave you with about a -2 prescription to keep those near objects clear, and then if you need to see things far away, you can put on a pair of -2 glasses. One more consideration we need to keep in mind when choosing the focus point of your vision after surgery is if you're getting surgery on one eye for the foreseeable future or planning to get both eyes done. If you currently have an eyeglasses prescription, say a -2, a -4, or a -6, we need to be careful about what leftover prescription we'll plan for after cataract surgery, because making the wrong decision can cause patients to be unsatisfied and regret their decision to get surgery. It might seem simple, right? If we have the opportunity to get rid of your prescription with cataract surgery, why don't we just do that? For example, if you have a -4 in both eyes and we decide to leave you with no prescription after cataract surgery, you will now have one eye with no prescription and one eye still with a -4 prescription. When you have such a large difference in the prescription between the two eyes, which we call anisometropia, it can lead to problems with depth perception and cause symptoms like nausea, double vision, headaches, and eye strain. Generally, patients can tolerate a difference of about 2.0. For example, one eye a -4 and the other eye a -2, without experiencing problems. So if we're planning to change your vision prescription significantly with cataract surgery, we may want to plan your second eye surgery soon after to avoid problems of anisometropia. So it's very useful to discuss with your surgeon what the plan will be not only for the eye receiving surgery, but also what the eventual plan will be for your other eye as well. Okay, so we did a deep dive on some common vision-related reasons why someone may be unsatisfied with their cataract surgery. Let's talk about another common reason why patients may regret their decision to get surgery, and that's dry eye. Now, it's very common for dry eye symptoms to worsen after cataract surgery. The good news is that, in the vast majority of cases, this is only temporary. These symptoms usually resolve a few months after surgery. But yes, patients may feel some eye irritation or a foreign body sensation or a sandy or gritty feeling in their operative eye. For example, a study from 2002 found that 37.4% of patients who received cataract surgery and didn't have a history of dry eye went on to develop dry eye symptoms after cataract surgery. But again, the majority of cases improved after several months with treatment using artificial tears, warm compress, or prescription eye drops. And for patients who already have a history of dry eye, then it's very likely that their dry eye symptoms will, at least temporarily, worsen after surgery. So it's important for us ophthalmologists to try to optimize the moisture of the eye and treat your dry eye as much as possible before going into surgery to try to decrease the severity of dry eye after your surgery. Okay, so we talked about different lens choices, focus points, and dry eyes. One other common reason why patients may regret getting cataract surgery is because they have other eye conditions that still cause them to have poor vision even after cataract surgery. Let me explain that a little more fully. When I evaluate patients for cataract surgery, oftentimes I find that they have other eye conditions like glaucoma, macular degeneration, retinal bleeding, corneal scars, and other reasons why they may have poor vision. And I always make sure to share these findings with patients before surgery to let them know, hey, we can do your cataract surgery to help clear up your vision somewhat, but we need to remember that you have other conditions. It could be glaucoma or macular degeneration, and unfortunately, cataract surgery will not treat those other eye conditions. So yes, we expect your vision to be better after cataract surgery, but because you'll still have that glaucoma or macular degeneration or whatever other eye condition even after surgery, those other problems will still affect your vision. And I understand. It can be disappointing and frustrating for patients to hear this because they really want to see better and they want to believe that cataract surgery will solve their vision problems. But unfortunately, for conditions like severe glaucoma or macular degeneration, we don't currently have treatments to reverse the vision loss that occurs from these conditions. And so it's important for us ophthalmologists to perform comprehensive evaluations before cataract surgery to check for any other eye conditions and to help set realistic expectations for patients. Okay, one other eye complaint that can pop up after cataract surgery is floaters. One common question I get from patients before surgery is, will my floaters go away after cataract surgery? And the answer is no. Unfortunately, your floaters will not go away after cataract surgery. During cataract surgery, we're working on the lens inside the eye, but floaters are caused by little clumps in the vitreous gel, which is located a little further back in the eye. During cataract surgery, we have no intention of going back into the vitreous gel. And so it's actually quite common that patients see their floaters even more clearly after cataract surgery, or they may see more floaters after cataract surgery. Fortunately, in the majority of cases, the floaters subside or become less noticeable over the course of 3 to 6 months after surgery. But yes, seeing floaters after cataract surgery is something that patients should be aware of going into the surgery. Okay, so we talked about some of the top reasons patients may be disappointed or regret having their cataract surgery. Getting cataract surgery is a big decision for patients, and I understand that. We receive the surgery once for each eye in our lifetime, and the results of the surgery affect how we see for the rest of our entire lives. And so I hope that you and your ophthalmologist take the time to consider your options carefully and decide which option will give you the most benefit and satisfaction. So, to summarize, we talked about how important it is to choose the best lens for your visual lifestyle and to be aware about the trade-offs of each lens. For example, multifocal lenses provide a larger range of vision but may have less contrast and can cause you to see rings around lights. Monofocal lenses, on the other hand, provide a much smaller range of vision, so you'll likely need to have a pair of extra glasses handy to help you see in different visual zones. We also talked about how important it is to choose the best focus point for your vision and your lifestyle. You want to think about whether you want to prioritize distance, intermediate, or near vision. We also discussed the possibility of developing dry eye after cataract surgery and how important it is to tune up any dry eye before cataract surgery to try to avoid those symptoms of having gritty, painful eyes after surgery. And we talked about how important it is to receive a comprehensive eye examination during your cataract surgery evaluation so that your doctor can diagnose whether you have any other eye conditions that may limit your vision even after cataract surgery. And we want to remember that, unfortunately, cataract surgery won't get rid of your floaters, and that you may even see them more clearly or see more floaters after surgery. So, I hope by reviewing some of the most common reasons why patients may be disappointed after cataract surgery, I can help you to avoid some of these common pitfalls, so you can be as happy and as satisfied as possible with your vision after cataract surgery. And please remember, even though I spent most of this video talking about when things can go wrong, the vast majority of patients who receive cataract surgery are ecstatic with their outcome. In fact, one of the most common regrets patients mention to me after surgery is that they wish they had done the surgery sooner. Okay, if you found this information helpful, don't forget to subscribe to the channel for future updates. And if you live in the Los Angeles, Orange County, or Inland Empire area and want to get checked for cataracts, feel free to visit our website or give our phone number a call to make an appointment today. And by the way, if you made it this far into the video, you're probably interested in learning more about cataract surgery. You can watch my video here to learn everything you need to know about cataract surgery. I'm Dr. Michael Chua. See you next time.